One of the cornerstones of outpatient spinal surgery is and is going to be partnering with our technology friends in the industry. Number one, they create the technology, and we depend on them as physicians, as a surgery center, and in society for the goodwill of these large corporations that invest millions of dollars in development. At the end of the day, there has to be a beneficial relationship in what the costs are of the products that allow us to do the minimally invasive surgery. The patients win, the payers win, the vendors can win, and the doctors can win with the ASC if everyone understands the relative role every party's playing. So for example, in developing outpatient spinal fusion using a protein, bone morphogenetic protein for example, that does not require a bone graft from the patient, decreased time, decreased bleeding, increased chance of fusion, there's a cost, and the balancing of that cost between the corporations making enough revenue to cover their investment and then the cost in the outpatient surgery center giving the patient this benefit, then we have a wonderful opportunity to decrease the overall cost of surgery, spinal surgery, compared to a hospital setting. And it's no different than going from the years ago to inpatient cholecystectomy through a big incision, to finally to cameras, and to finally migrating that operation out of the hospital. This is exactly the same path, same strategy. What used to be a big incision is now a small incision. We have to have the technology, we have to have the right cameras, the right equipment, the right tools in an outpatient setting. And then all these bigger, more complex cases are not so complex. They're not so big. They're only big because of the way we did them. They're not big if we do them differently. And we're getting the same benefits, decompression, stabilization, whether it's static or dynamic in an outpatient setting. Patient perception is better. Patients aren't as afraid. Everyone wins in that relationship.